Today on CityLine, it's Makeover Madness. We have everything you want to know about rhinoplasty, choosing the most flattering makeup for your eye color.
Blue is a naturally cool color, so you want to accent it with a warmer color.
And a peek at far out fashions right now on CityLine.
Well, you know this. Rhinoplasty surgery has come a long way, and Dr. Mulholland's patient, Tracy, is very happy it has. Take a look.
Okay. Tracy, come on in, have a seat.
Thank you.
So, are you excited about today?
Very excited.
Rhinoplasty to this day remains one of the most common things we do in plastic surgery. It's not something that you can fix with diet or exercise. You're usually born with it, and sometimes it's after trauma or an injury, but mostly you're born with a nose that doesn't match your facial proportions.
So I'm having a reduction rhinoplasty. I'm going to have the whole end of this bone reduced, and to reduce the tip as well.
Tracy is the prototypical ideal patient for this, and she's very elegant. She's tall, she has strong angular features, and her nose slightly exceeds the beautiful facial proportions she has, so she has classic nasal facial disproportion. We can really individualize the nose to the patient, and it allows me, the surgeon, to understand what she wants, to select out a patient that might be totally unrealistic and point out things that she might not even realize about her nose. And the procedure's gotten much easier because our anesthetic techniques and the anesthesia's got much gentler. And we can usually do the procedure in about an hour and 10 minutes. It looks acceptable at a week to 10 days, 8 months, 80%, and 1 year, what you see is what you get. So the nose settles very slowly, and that's very helpful because patients are worried about a sudden change and everybody noticing.
Most people haven't noticed. They notice something's different, but they can't put their finger on what. I'm very glad I did it. Finally, I should have done it 15 years ago.
She looks amazing. Tracy looks amazing. So this is so interesting. You say that, you know, she's a wife, she's a mother, she's got kids, she works, and she was sort of waiting for the right time in her life to go and pursue this surgery. She wanted to make sure that she had some time for recovery and all that. Yeah, right?
Recovery is important. You need about a week off to look acceptable. Yeah. Make up some excuse like I missed that fly ball during my softball game, or I hit my nose on a cab door.
I don't think you have to lie anymore. Just say I want a new nose. And then go get one.
Well, some people are that confident that they will say that. Others need some type of subterfuge to escape the stigma that still exists around cosmetic surgery.
Right. Okay. So she came up with her excuse. She went and got it done. She looks incredible in the after. I'm wondering, when it comes to rhinoplasties, which have been really popular for some time now, is it mostly women or men? Because most people would think it's mostly women. Is that the truth?
I would say it's about 80% women, because women tend to be more confined to the beauty constructs that we have in Western culture. Yeah. And so a dominant nose on a feminine face, or a nose that isn't strong enough, or a bulbous tip, so bumps, scoops, and tips that are bulbous, will bother women typically more than men, who could, you know, look bald, fat, portly, and pugilistic and still get away with it.
Yeah, what's up with that?
You know, it's crazy. You know, we're measured more by power and money than beauty and proportion.
I want in on that action. Like, I just want to gain 200 pounds and be okay with it. Because men have got that going on. But anyways, that's a whole other show. Let's talk about the cost of rhinoplasty. What's the range?
Well, most cosmetic rhinoplasty, remember, there's a functional component. So every time we do appearance nose surgery, we always have to balance the breathing. The breathing is covered by the healthcare system, so there's no cost associated with that. But then the nose surgery will include the anesthesia and the nurses, and, you know, so it's not always the surgeon that's getting that fee. But the range in price in Toronto would be $3,000, $3,500 to maybe $8,000, depending if it's just a bridge, just a tip, or something internal, or a combination of all three.
What was Tracy's? Was that just the tip?
Tracy was dropping the tip, adjusting the bridge, breaking the nose, and fixing the breathing. So she was a combination of all those things.
So you're actually breaking the nose, right?
Yeah, there is disrupting the bone. I don't use the word break; it sounds scary, but yeah, you have to break the bone if you're gonna set it back towards the face.
And afterwards, is her nose working as well as it was before? Is there any sensitivity lost? Does anything change?
Yeah, there is a recovery. Like all surgery, it's very important patients understand the recovery process. So you start out with packing in your nose, so there's no bleeding the first 3 days. You have a cast on, and at a week, all that is off, but you still have a swollen nose, so no one really notices it initially because it's swollen. You have your excuse, and then it changes gradually week after week. By about 3 months, it looks pretty good. By 6 months, it looks great. And then there's a little loss of sensation that will take about a year to come back. So most people, as Tracy had a significant change, no one really even noticed.
Yeah.
They would say something like, "Oh, have you lost weight?" or "I like your hair." Comments like that.
Yeah, but that's kind of what you want, right?
Exactly.
They don't necessarily want to know, well, you changed your nose. It's just something looks different and actually looks better. So how do you decide what nose is the best nose for you? What do people do? Do they come in with pictures?
Yeah, some people come in with some pretty crazy pictures, like that Michelle Pfeiffer nose won't look good on you when you know you're 6'4". So generally, I look at the pictures, acknowledge, but then we have a lot of high-tech 3D computer imaging. And so like Tracy, I can sit down and say that nose may be what you want, but this is what matches your face, and walk through all the changes, and we can usually deliver those changes. So gone are the days where women will look at their nose at 6 months and say, well, I don't really like that, because they can see pretty much what it's going to look like before they do it. It's like a, try before you buy.
Right, and most cosmetic surgeons have this, right?
I would definitely seek out those physicians, whether you're doing breast augmentation or nose changes, where you can simulate the surgery. And so, yeah, I think you'd want to search that out if you're a patient. Absolutely,
because that's crucial. You want to know what the end result is going to be like. Thank you very much, Steve. That was great.
Thank you.
Let's go to break. We've got more coming up. It's Makeover Madness. Interesting.
Welcome back to CityLine. At the start of the show, we told you about the injectable rhinoplasty, but before we show you the results, we're going to show you a surgical rhinoplasty. Take a look at this.
Shannon, Dr. Mulholland's ready to see you now.
Okay, thanks.
And so your profile shots bother you the most, and our goal is to take that bump that has been with you now for a very long time.
Yes.
And to reduce that bump.
I'm happy where I am. I've got a great job. I'm engaged. I've got my wedding coming up next year. And, I thought now's the time better than ever to enhance something that has been bothering me for years. I'll deal with it. Maybe I'll fix it. No, I'm going to deal with it now. I'm going to finally enjoy my profile, stop throwing out all those pictures of my profile that I hate. And basically, all I'm really doing to me is I'm going to like my nose.
What we're going to be doing is approaching her nose through a procedure called a rhinoplasty, or common parlance would be a nose job. And what she really, really dislikes is her profile, her side shot. And so she finds that she's very self-conscious when she thinks people are looking at her from the side, doesn't like taking pictures from the side. And this is a hereditary overgrowth of cartilage and bone on the bridge of her nose. She's got a very strong bridge. And it really detracts from some of the angular, pleasant features that she's got. And so what we'll be doing is we'll be shaving down and chiseling, much like sculpting, the bridge of her nose. Now the trick is, of course, to leave it still looking narrow and natural and not over-reduced, because that 1970s ski jump appearing bridge is just not very popular right now. And her stated goals really are, Shannon's goals are to look natural. Shannon,
Hi,
good to see you again.
You too.
How have you been?
I'm fine.
You're looking great.
Thank you. The overall results I'm thrilled with. I'm thrilled. I no longer feel intimidated by my profile. I like how I look in the mirror. I did before, but now I have a new way of looking at myself. It's a bonus. I liked myself before, and I just didn't really like this bump in my nose, and I really am pleased with the way that I'm still me.
That's great. That's great. Now, the swelling of that takes some time. I mean, first of all, when you take a look at the nose, it looks a little battered there for a while.
It does.
And that you showed us about 10 weeks later. Really, what is the length of healing time then?
I tell patients that the first, when you get your cast off at 1 week,
right.
You're going to look in the mirror and go, oh my God, he didn't do anything.
Right.
Because it looks maybe sometimes bigger than what you had. But the nice thing about the nose is it settles week after week after week after week. So it starts to look like there's been an improvement by about 6 weeks. By about 12 weeks, it looks really good. And by 6 months, your final result occurs. So you're not going to walk into the office, everyone's going, oh my God, who did your nose? It just doesn't happen that way. It's such a subtle and slow resolution of the swelling that I can't remember in 10 years of doing these that anyone came in and said, geez, everyone's talking about my nose. No. They say, have you lost weight? Or your hair looks good? Exactly. Or something like that.
Yeah, all those things. Which brings me to this point, though. The style of noses have changed over the years, okay? Yeah. They have. Everything's in style. The more natural look, the ski jump. Remember the big ski jump nose? That thing.
I trained really in the 80s, and everything was that big, you know, Dallas and Dynasty sort of nose job where, you know, it was the giant slalom, basically. It's gone back to a much more natural, women and men particularly just want a bridge that fits their face and doesn't stand alone in isolation, but blends in with the cheeks and chin structure. That's why I use computer imaging, because I go through the computer of what I think would work for them, and they go, oh, I don't think so. Or they go, yeah, that's exactly what I was thinking.
Yeah, because you need to, you as the consumer need to see the vision of what it's going to be like.
Right. You can always imagine if your hips were a little thinner, your tummy was tighter, or your jaws were lifted, but with your nose, you can't kind of go, oh yeah, that would look good.
Now, does the nose keep growing?
It does, actually.
Even after you go in there and do some stuff, the nose and the ears keep growing, don't they?
Everybody thinks that, Jesus, 19 and 20-year-olds that have their nose done, probably the most common group of women that I do noses on are in their 40s and 50s, because their cheeks have lost some fat, they've deflated a bit, and what was a happy-looking nose now looks more bulbous and round and Carl Malden-ish, you know, it's just sort of...
Everyone's doing this.
But it does. Your cartilage has life. The sebaceous glands in your skin have life. It keeps growing while the rest of you is deflating.
Will I still be able to breathe?
I thought you were going to say pick.
No,
yes.
No, not pick. Well, that too. What the hell?
No, breathing is an issue. So when looking at a nose, even with the injection nose job or the surgical nose job, we start with function. So I look inside the nose, and we do fix function at the same time we fix the appearance.
Okay, and the cost?
The cost in this city would range anywhere from about $4,000 to $10,000. So
what would make it a $10,000 nose job?
Let's say there was some more work to be done on the septum, or maybe some cheek or chin balancing, because some people have a very weak chin and a strong nose.
Oh, so sometimes it's kind of a little bit of a domino effect that you might have to do. Okay.
Right, balance the 3 points, cheek, chin, and nose, so the triangle looks normal.
Okay, and then you, I know in your office, but a lot of doctors are now picking up on your lead, and that is you can do time payments. Yeah. You can. So you don't have to be saving the money, you know, all at once. So there's a down payment on my nose.
There is. About 5 years ago, I thought, well, no one's doing financing. And in reality, probably about 50% of patients now treat their cosmetic surgery like a car.
Yes.
They say, well, I'm going to use someone else's money at a reasonable rate, pay for it for 5 years, and then see what other model I want.
Yeah, exactly.
And it's become much more of a affordable.
As we mentioned at the top of the show, there's the non-surgical rhinoplasty as well.
That's really taken off. I do a lot of 5-minute nose jobs, and these are injection treatments for 2 types of noses. There's the scoop and the bump. So if you have too much of your nose, we can soften it with some stealth injection techniques above and below the bump with some really nice results. And then if you don't have a bridge, we can build your bridge up. We can narrow the appearance of a tip. So, you know, I've trained probably about 800 doctors across the country on this technique, so it's readily available anywhere that your viewers might be.